Hi everyone, Dr. Harmon here. I'd like to talk a little bit about filler in the jawline. There are three locations where filler is often placed in the jawline. The chin, right where the marionette lines are, and at the back angle of the jaw, also known as the gonial angle. There are many different hyaluronic acid filler products that can be placed in the jawline. In fact, one has been approved by the FDA specifically for this location. The first area, the chin, is a very common place to put filler, and it can be a really nice treatment for a flat or protruded chin. It's a temporary treatment, and it can be a way of seeing if a patient likes the shape of the chin with filler before placement of something more permanent like an implant. And implants can come in many different shapes and sizes and can even be carved to the specifications of the patient. The second area is at the marionette lines, and marionette lines form because fat pads in the cheeks and along the jaw hang down and forward with age. And they hang down and forward over a tight ligament, and that ligament is where the marionette line is. Now, filler doesn't treat what actually changes as we age. It's simply there to mask or soften the appearance of the marionette line, and that's why it's not always a good place to put filler. A better option would be a deep plane facelift or neck lift, or in my instance, the extended deep plane facelift and neck lift, which is an advancement on the deep plane surgery technique. The third location is the gonial angle, and the gonial angle is a common place to put filler for men who have a weak or poorly projected jawline and would like it to be a little larger. It's often not a good location to place in women because it can make the lower part of the face look more masculine. And if filler is placed in the jawline, both at the gonial angle or the mandibular angle or that corner, as I mentioned, and the marionette lines, then you run the risk, if too much is placed, of making the face look even more bottom heavy and more aged than it otherwise would be.